everyone, this is Dr. Jamie Marich with the Institute for Creative Mindfulness. As a lot of you know who watch my videos, I'm an EMDR clinician, trainer, author, and I'm very happy to have with me today a fellow Institute for Creative Mindfulness team member. He started as a student. Technically, I still mentor you. Technically, but we've been working on a lot more collaborations in our writing and some of our work together. So this is Adam O'Brien from Chatham, New York.
Great.
And earlier in 2019, the Institute for Creative Mindfulness published a blog that gives you a little bit of an overview of a model we've been working on called addiction as dissociation. And one of the reasons I have Adam on camera today is I'd like us to just have a mutual conversation to kind of let you into some of our thinking as to how this model came to be. So I've been very open about my story on social media in these teaching videos. And just to summarize it for those of you who aren't aware, I'm a person in long-term recovery. I identify on an abstinence-based path from addiction. I have 17 and a half years sober. And I got sober and then entered the field, like a lot of us do, when I had about a year and a half of recovery. And I started graduate school. And when I was about just shy of 2 years sober, I noticed that I was getting phenomenally triggered by the work setting, by doing the graduate internship. And I had a coworker who did an intervention on me, essentially saying, you were dissociating significantly at work. Like, it feels like you're, and I knew it, like I didn't fight him when he talked about it. I knew that I was checking out constantly. I knew I was doing a lot of these behaviors that when I was a child were described as, Jamie looks like she's been beamed in the head with the fastball. And it was interesting because as part of a lot of my initial addiction treatment and care with a sponsor I had who was very trauma informed, we definitely identified dissociation as part of my childhood profile. It was not something I would say I was attuned to when I was drinking or using, because I was drinking and using. There were some other self-injury and dissociative behaviors that kicked in, but it really wasn't until I visited my first EMDR therapist in 2004 that I was properly diagnosed with dissociation really being the biggest part of how trauma manifested for me. And it made a lot of sense now that I especially could look back at it now, that at 2 years sober, those symptoms really started showing up, that the drug and the alcohol use had essentially been arrested, but that dissociation that was there first still really needed to be addressed. So it has always felt like such common sense for me in my teaching to highlight these connections between dissociation and addiction. And a lot of children who dissociate naturally can develop tendencies towards what we would call addiction. And then when the addiction clears up, there's still a lot of dissociation there that has to be addressed. And I've been trying to highlight the treatment field of that reality. And it's so interesting because we've really made this push to be more trauma informed in treatment, and we're kind of getting there. But I think a passion that you and I share is helping the treatment community be more dissociation informed.
Right. And addiction informed.
Yeah.
And how that plays into the cycle of trauma.
So let's hear your feelings, beliefs, kind of what you've been developing in your clinical work on that.
Well, I mean, it really started off with recognizing that as a person in an addicted state, I felt stuck between a rock and a hard place of what to do. And that stuck feeling, when I started studying was able to get sober and started to study and hear what this was, because I wasn't convinced when I was in rehab that they were telling me what addiction was, because it wasn't something. I can understand the concept of being multifaceted. I could understand the layers, but even the roots of addiction, there were so many of them. And, conceptually I could understand that, but that stuck feeling, wasn't explained until I started really reading about trauma. And when that made sense, and that was captured being re-experiencing, started capturing the negative beliefs, strong emotions, all of a sudden it's just like, well, addiction fits that definition of trauma.
So this is a fascinating point, because a lot of what I hear in my work and people who send me messages and all of this are like, well, why do you still use the word addiction? And it sounds like, I think a common thread you and I both share is we both still feel there's merit to the word and the concept addiction. It's just it's not being defined
Right.
correctly or with enough understanding of trauma.
Right, and that goes to, you know, the normed experiences,
Mm-hmm.
and you know that within a range, people can have connections to things that may be, you know, unhealthy for them, but taken to the extreme
Mm-hmm.
is really where you see the outliers of the problematic behavior.
Mm-hmm.
And the dissociative aspect to it, I think, is kind of, you know, kind of an absent child in the conversation,
Mm-hmm.
because you know, trauma induces that, and it's supposed to happen. Addiction to an extreme is going to produce a life of its own.
Mm-hmm.
And I think that could even be, you know, symbiotic in a dissociative state, is that it takes on a life of its own.
So before we go further with talking about the model, just a quick language lesson here to make sure anybody who's listening to this is on the same page. So trauma comes from the Greek word meaning wound. And the quick and dirty definition I use of trauma in so much of my work is it's any unhealed wound. Dissociation also comes from, well, trauma's Greek, dissociation comes from Latin meaning to sever. And so when we're talking about a dissociative experience, it's anything that our system does to sever us from, whether it's a present moment, whether it's an aspect of self. That severing can happen in a bunch of different ways. It's an inherent mechanism of the brain that can help us essentially cope and live in a traumatized state. So trauma is wound, dissociation is severing, and addiction comes from addicere, which is Latin meaning to be surrendered to or favoring something. And as we talk about in a lot of our work here, to be bonded to something, and I'm sure Adam will chat about this here a little bit. So just to make sure you're on the page about what the words mean as we go into talking about the model.
Right.
So when we talk about this phrase, addiction as dissociation, how would you give your general description of what we're getting at by trying to get this out there?
Well, it's a manifestation. Addiction is a manifestation of dissociation.
Mm-hmm.
And you know, you mentioned it, that you know, dissociation happens before you put a drug typically into the system, and whether it be a behavior, you know, they don't burn as bright as adding a substance. And that's when I think, you know, that's why this is, you know, substance addiction is, you know, recognized as, you know, a bigger problem, because it really burns a lot brighter. But the behaviors, you know, on a normed range, you know, we can get there. And so to me, addiction as dissociation is really recognizing that the dissociative patterns that we are coming to know more about as the study of trauma has been increasing, and the study of dissociation, and how these worlds are, you know, interlinked. Those processes that we don't necessarily, you know, re-experiencing is in the PTSD diagnosis, but reenactment is one of the facets of it that really fascinates me with dissociation, is that there's a life taking on a life of its own. And that's, you know, again, going back, that to me is that definition of addiction. And how I define trauma, because I prefer to try to be a neutral thing, and I agree with, you know, your definition of it being a wound. But a wound is assumed to be a bad thing, but it really depends upon when you look at it, because wound gives you the opportunity to heal. For sure. So to me, with the addiction being stuck, to me, a trauma is anything that's still staying with you. And if addiction is still staying with you, it could be in that process of the reenactment, which is a dissociative process, and that kind of self-perpetuates. And so to me, the definition of dissociation is one of the tougher ones, is because it really underlies a lot of our defense mechanisms, you know, a lot of what we do. It is within a normal range. We're supposed to do. A long car ride gets kind of boring if we don't dissociate. The files back up because we're creating too many memories.
So something that you've really added to our work in this model is this idea of becoming bonded to the dissociative state.
Right.
So if you can give us a little explanation of how you would explain that to a client.
Well, in that experience of, like, you know, going on a long car ride, you're looking out the window and you're kind of whistling and you kind of have like, things going on in your own mind and you're kind of, the world, being bonded to that world of, to not being there. And for me, in my own story, there was a recognition that dissociative state was something that I had been at when I first did a drug. It was a relationship to something that I had already been, but I had forgotten about it. And I had a near-death experience when I was 4, and it was a bright lights kind of a thing, but it was also like I remember being there, being like, this is, I feel safe here, and this was one of the first times I felt safe. So, numb and safe was what we bond to,
right?
But who's defining it? To me, the 4-year-old who almost died was like, oh, I actually feel, I feel comfortable here. And then a recognition of that when I first did a drug was like, I've been here before and I like this, and it was like that safe feeling. And that's why I try to take a more neutral definition, because
for sure,
it's when who's defining it when.
That's a good point. Something we write about in the model is once chemicals or other reinforcing behaviors can enter the picture, it can amplify of already familiar state. And that was definitely my experience, because so much of how dissociation really manifested in me from very early on was the classic escapist types of things, that being here was so unpleasant. So whether that was having this fantastical daydreaming type of world, being able to take myself into the zone out state that seems to happen so subconsciously rather, that once, honestly, it was food and self-injury for me first, and then chemicals, that each progressive layer of that helped me go there quicker, more effectively. And so I am very resonant with how we've worded that it amplifies an already familiar state.
What I have found is asking clients what dissociative state, maybe not using that language, but what did you check out in to get through your your adolescence, or even like grade school. A lot of it's I would say that before drugs there was music, there was sports, and I played soccer for 11 months out of the year. And that's a lot. Some people it's studying, some people it's video games. There is some type of healthier dissociation that people bond to. That when a drug is introduced, it's already a pattern that's already been established. That their body already recognized as like comfortable, or like it works and it's effective, and drugs are very effective. And why not go to the one that is the most effective?
So the other thing I want to make sure we get on camera is to talk about how do we treat this. So if you could wave a magic wand, what would addiction treatment look like?
It would look like trauma treatment. And the phase model that trauma treatment offers us is, a preparation / stabilization phase, memory work, and then maintenance work. And maintenance work is very similar to stabilization, same skills, just back end of the other side. The memory work that we which we quote in some of the work, is that there actually is an addiction memory that they started theorizing in the 70s. That like there is an addiction memory, because metaphorically we've been talking about Dr. Jekyll and Mr. Hyde. We've been talking about chasing the dragon. That's really chasing the first high.
I know we use Jekyll Hyde, but the part of you that wants to get sober and well, the part of you that is identified with the addiction. And there's just a lot of threads here for bringing in parts work on many levels. Right.
So parts work and resolution methods, trauma resolution methods, and the memory work. Yeah,
and obviously for me, stabilization, preparation, whatever we're calling early stage work, also has to include a very trauma and dissociation informed view of mindfulness. Because I have a whole business called the Institute for Creative Mindfulness, right? Like it really permeates everything that I do.
Right.
Because fundamentally, it's not enough to tell people, just live in the now, stay in the present, which is what a lot of old schoolers have done, one day at a time, Adam. Come on. We have to teach people how. And for me, various forms of mindfulness, whether you're talking about traditional meditation or some of the activities you mentioned, mindfully engaging with sports, mindfully engaging with music, mindfully engaging in the expressive arts, to teach people that they can build a sense of it's okay to be in this now, whatever it is, without having to escape it or sever from it. So, I mean, I think all treatment should be very activity oriented that works with mindfulness. And it's worth noting, and this is somebody we cite in the paper, Christine Forner's work, that dissociation is really a state of missing mindfulness. It's would be fair to say that dissociation is the opposite of mindfulness. So the answer isn't, well, just then don't teach mindfulness because it's too triggering, but it's how do we instruct a lot of these mindful skills in a way that appreciates how difficult it can be for the person to learn them, but to not let them off the hook when it comes to the imperative of living in the now, whatever that now may be, is probably your best survival, thrival skill that we can teach you.
Right. Yeah, and having that 1 foot, and celebrating that the other world that we have, but within a balance.
Yeah.
Not going to the extremes.
Right.
Because we can find our extremes going to exercise, sex, food, and stuff like that when we first get sober. If we get addicted to balance, that seems to be the most logical.
That ought to be adaptive. I mean, when you word it that way.
Yeah.
Well, it bears mentioning that even when I teach on dissociation, I discuss how there's nothing, that dissociation is a fundamentally human experience, that there's nothing to really be ashamed about or to shame it as a construct. But there is this idea of the kind of maladaptive, adaptive continuum that I think we have to help people evaluate. Like, when I exercise, is it really helping me connect to the moment and my wellness and my intentions, or is it helping me escape on some level? And I know I have to do a lot of that evaluation for myself. As some of you who follow my work know, I do a program called Dancing Mindfulness. And a big question that I ask people to consider in that practice is, are you dancing to escape? Or are you dancing to be more present with what is? Because I hear a lot of people say to me, like, oh, when I dance, my problems go away. When I dance, I disappear. And I don't want to shame you, or like if that helps you on some level, that's on you. Yeah.
We need that too.
Because yet what I challenge people to do in the practice is, can you use it to help you be here with whatever is coming up? And if you do happen to do some dancing to escape, maybe look at a different word. That might be, because I think of one of my great dissociative behaviors that I still think can be very adaptive for me is the Netflix binge. And as somebody who, true confessions on the camera, who still has a lot of workaholic tendencies that I have worked to address, I get the irony in that. For me, being able to just lay on the couch and chill and be with something like a Netflix binge, which is often labeled as dissociative, is actually more adaptive than if I would dive into more work on any given Sunday afternoon, just because feelings. So.
Well, and that key piece of it being, can you do it mindfully? And I remember leaving my rehab, I was telling my counselor, my inpatient, and she was talking about my work, and we didn't really work together because it's that kind of environment. You just you're safe to leave, okay. But we were talking about my work and stuff like that, and I told her that I worked in libraries, and how much I'm a big reader, and reading is one of those things that, am I doing it to escape or am I doing it to learn? And am I watching documentaries or a Netflix binge? It's still serving some need for, in a sense, more, whether it's more education, more story, more all those things like that. And it hides in everything we do, and any relationship that we have, and it goes back to that bonding, can we bond to it in the healthiest way and create relationship instead of having it be a toxic bond?
Yeah, and I think for me, all these years down the road, and still very much a work in progress with it, it's more about, can I embrace life versus try to push it away?
Right.
And the more that I embrace, knowing that I'm human and will inevitably do things to push it away, I think the healthier I am.
Yeah.
So, well, thank you for joining us on our chat. If you haven't checked out our articles yet, we'd appreciate you doing that. The first piece we wrote together is actually, it's still one of my favorites that I ever did in article form, which is essentially an instructional manual in article form on dissociation for addiction treatment providers. And how a lot of these behaviors treatment providers will kind of call it as, oh, they're being disrespectful, they're this, they're that, really could be seen more through this frame of dissociation. And then we have our addiction as dissociation model that's out there, and hopefully there'll be some more to come. Thanks for joining us.
Thank you.